Welcome. Thank you so much for giving me this opportunity. I think it's so important that I think it's going to be one of my most excited interview, and you will see why. Welcome to Globaldancenews.
Thank you so much. Thank you. I'm glad to be here.
I want to start by asking you this. That is, specialists, like for example, knee specialist, shoulder specialist, there is physical therapist, massage therapist, and some teacher ask, some students ask me, where should I go? So the question is, when is the right time to go to those different doctors?
That's a really, really good question. But first of all, I just want to take a moment to say thank you for what you're doing.
Oh, thank you.
Because I really, really love your philosophy. The original phone meeting that we had, I was so impressed with how you're trying to bring this knowledge to so many young dancers. It really needs to be done. So thank you so much for what you're doing. And again, thank you for including me, because this is one of my passions. I love disseminating this information. So it's good. Yeah. So when I have a young dancer who has, so hopefully, I think one of the things that's important, hopefully there's some sort of physical therapist or athletic trainer or physician associated with a local ballet company. I think that's always like a great first start. I get a lot of interesting inquiries that way. They'll call the company manager at Ballet Austin and they'll say, well, who do the dancers see? My daughter dances locally. And I'll get to see someone that way. And that's really great to see a dance medicine specialist with a dance injury versus going straight to an orthopedist or necessarily straight to the pediatrician, who more often than not in the states that we live in, right, are going to say, well, just don't dance. If you have pain, don't dance, right? That doesn't really work. They would not say that if a football guy came in, right? Or if someone on the high school basketball came in and said, this hurts. They would say, oh, let me help you get to the bottom of this problem, right? And so when you see a dance medicine physical therapist, dance medicine physician, a podiatrist who has that dance medicine experience, you're getting someone who has that mindset already of like, dancers are athletes and dancers are more than athletes because they're artists as well.
I want to agree to disagree on this, because do you think that's normal that kids need to go to see, for example, a chiropractic even before they have to see a specialist?
Yeah, that's a good question too. And it really depends on the State Practice Act. So in many states, well, Texas is actually one of the states, there's only a couple states left that don't have direct access to physical therapy. So in many states, you're allowed to go see a physical therapist first. But even 5-10 years ago, you had to see a physician first to be able to go see a physical therapist. So yes, I do think that paradigm is changing a little bit. And I just want to say that it depends on the severity of an injury. Right? If it's a really severe injury, well, by all means, certainly go get that urgent care to the ER as a last resort, right? But urgent care, get to your pediatrician, get to an orthopedist, right? But if you have a nagging kind of injury, right, I really do think it's best to see someone who is not going to want to do surgery, someone who's not going to want to say, don't dance, someone who's going to want to help you get back to your optimum as quickly as possible. And then you mentioned something about chiropractic. So in general, I don't love chiropractic work for dancers because dancers tend to be hypermobile, right? And chiropractic work is very much quick thrust manipulation, which it sometimes is called for, but more often than not, dancers have too much mobility. They need stability. So they need to see a physical therapist, a PM&R doctor, someone, an athletic trainer, who works with dancers, someone who can get to the root of the problem and help them get more stable to get the injury under control, rather than having a quick fix and it goes back to where it was, and another quick fix and it goes back to where it was.
Yeah, now, but wouldn't that matter? For example, like I have gone to chiropractics, but not necessarily because I haven't injured. I have been going there because I like to adjust myself sometimes. I have great experience with great chiropractics. Now we come to the same that I said before. Before, in my time, back in the time, you will only go to a chiropractic because you want to adjust something, a shoulder popped up something, then you go for that. Nowadays, there is some chiropractors that they study like a bunch of stuff, so they are more complete in terms of how. Am I?
Definitely. Yeah. So I really think, just like with physical therapists and physicians, you have to do your research. You have to find someone that is good for you. So, a quick fix obviously is not a good idea, but a chiropractor who is practicing holistically, doing trigger point therapy, adding in maybe a little bit of acupuncture, right? Looking at the entire body system, obviously that's a much better choice.
There is a phrase that I have heard so much out there. Student comes to me, a boy of a girl with the parents. Hey, Mr. Israel, she's not feeling well, or he's not feeling well. I'm going to take her to a physical therapist. I'm going to take her to the doctor. Good, perfect. So they go. Of course, next day I will ask them what the doctor says. And they will say, oh, they said that he said or she said she's young, just to walk through the pain. I disagree with that.
Oh, definitely. And so that goes into like the typical personality I see in dancers tends to be very perfectionist, right? Dancers are hard workers. They're overachievers characteristically. And when someone tells them to dance through the pain, they're going to do it. They're just going to keep going and going and going. And that's what I see leading to stress fractures and a really poor pain response, a really poor kind of mind-body response to like pain. Pain should signal that something's wrong, and you should stop doing that thing when you feel pain. You shouldn't become immune to that mind-body connection. That's really not healthy holistically in life.
That's correct.
So I am not a believer in that at all. I'm a believer in like, how can we modify the technique? What can we look at? Can we look at strengths and weaknesses in the foot and ankle, in the hip even, in the abdominals, right? Look at something in the technique and alignment that is, maybe that is where the reason is coming from, that foot and ankle is hurting. And I would never, ever tell a dancer, just dance through the pain.
Some said is, that thing that grow when the kids are growing, is growing pain. Let's think.
Yeah. So let me speak to that for just a second. So please. Definitely that growing pains, that is a transient issue of adolescence, and it's a true thing that happens, growth spurts, and bones grow first and then slowly catch up to that bone growth. And so what I see in my young dancers that might be going through puberty, and they might have one day where they just feel like, this perfect pirouette, they're right in the center, and literally the next day they're like completely all over the place, right? And that's just one small example, but it can be a much larger example. And these growth spurts can happen over the course of many, many years, for several months or a year. And I think it's really important to educate dance teachers, the parents, and the dancer himself or herself, right? About like, this is not your end all be all. This is a moment in time.
Give me the top tips to avoid injuries.
Okay, this is good. Okay, I would say what I've been focusing more on lately almost is sleep hygiene and nutrition. I have so many young people that are just on their phones all the time, constantly. We know that too much blue light can upset your sleep rhythms. And so if that dancer is not getting proper sleep, or they're staying up all night, they're already in a state of fatigue. And we know that 80 to 90% of dance injuries occur when you're fatigued. So sleep hygiene is huge. I like to talk a lot to my dancers about nutrition, what they're eating. So many people these days are on paleo diets or vegan. I really don't agree with these types of diets when children are still bone building, right? We're bone building up until at least age 18 or 20. We need calcium, we need vitamin D, we need good sources of protein and fat. All of those are building blocks for your body to last for life. So sleep hygiene and nutrition is huge. And then obviously another thing is technique. So I talk so much about technique and alignment because ballet, we know, is very aesthetic, right? We have to look a certain way when you do ballet, which does not always go along with what the body does naturally, right? So I almost sometimes feel like I'm in like a little bit of a crosshairs with teachers because I'm telling the dancers one thing, to take care of their bodies for the rest of their lives. And dance teachers are telling their students one thing, to make them look a certain way for this particular show, this particular move that they need to be doing. So what I try to educate my dancers on, and I'd say this is probably one of the other number one tips, is how to advocate for yourself. The sooner you can do that, the better. And it's in all facets of life. That's why I think dance is so great for young people. So it's not just in a ballet class. It's being able to speak up for yourself and say, actually, you know what? This doesn't feel very good right now. Can we try it a different way? Can I sit down for a moment? Or, right? So it's starting to learn how to speak up for yourself and say how you're feeling to your parents, to your dance teachers, to your school teachers. Yeah, it's a big, big deal. And I think Ballet Austin has been really great at, we want to know. We want to know what's going on. We want to help you. So I hope more and more companies come along like that.
So oh my goodness, sorry.
Oh no. Water.
Yeah, that's why I have this over here.
Water.
So let me ask you this. Do you think a student should stretch even before they warm up when they get to class?
No. They don't need to do deep stretching before class. So the best thing to do before class is some sort of metabolic warm-up to heat your body up, whether it's a light jog around the studio, some jumping jacks, some burpees, abdominal work, right? A little bit of core abdominal training to wake up that muscle system so that when you are standing at the bar, those muscles are awake and ready to support your body. And so stretching should always be at the end of a dance class, the end, and not for too long. We always say in the dance world, 30 seconds, 3 to 4 times. That's it. I had a young dancer who was having terrible hip pain over the course of like 6 months or so. And I was like, just trying to get to the bottom of everything. And I found out she was sitting in that frog position. She was just hanging out in frog, reading Harry Potter. So literally she was hanging out in frog, which pushes the head of the femur, the hip bone forward over and over. So no wonder she had anterior hip pain, and she was reading a good book. So it was, you know, she was there for like an hour and a half sometimes. I was like, oh my goodness, I'm so happy we finally got to the bottom of this. So the prolonged positions for dancers are really not good because it pushes through ligament. And ligament is meant to stabilize joints, to hold joints together.
Let's talk a little bit about what you do. And you might say, oh, we should have talked to start with that. But no. I know you created a program. Can you tell me all about that? I know for a fact that is amazing. And I think I will send anybody to you to get all the advice and to get, honestly. And please tell me a little bit about that and what you do, how you started and everything, please.
Yeah. So, I mean, it's really kind of what you're telling me that you see. There's a dearth. There's not enough of dance medicine professionals across the United States. And now we've got this great advent of telehealth and being able to see dancers online. So what I've been doing is creating a dance wellness coaching program. And so I can meet with dancers online and assess their technique and alignment, listen to them about, you know, what questions they might have about dance, about their bodies, right? Many people are not able to answer those questions, just like you were saying. And so I'm here to listen. I'm here to like offer advice, offer suggestions. And then I get to see them move, right? Offer some tips on alignment and technique to make sure that the dancers are operating at their optimal efficiency, you know, so that they will not create injury in their system. And then always giving a few exercises to make sure that they have something to do before class, right? To take care of their body. Say they come to me with hip pain or knee pain, something with the foot and ankle. The idea that you said, the one heel is not getting higher, right? There's ways we can take care of that. And there's ways we can do that online. So it's been great. I love it. I love meeting with dancers all across the United States. I've done 30-minute sessions. I do hour sessions. I have different tiers of involvement. So people can meet with me just once for 30 minutes. They can meet with me once a month. or once every 2 weeks. And so there's different tiers that have cute little names. So yeah.
Is there the similar programs out there?
Oh yeah. Oh, are there similar programs? I
Like
haven't
yours?
seen any similar programs. No, most dance medicine specialists are operating typically as a physical therapist. So waiting till an injury occurs. I don't want to wait till the injury occurs. I want to see dancers before there's an injury. I want to create better habits, right? I want to create wellness throughout, my dancer's entire life, not just in the dance studio, but, the sleep, the nutrition, total wellness and good tips for life, really. And young dancers are just so fun to work with because they're willing to change. They're sponges, they're absorbing, right? It's wonderful.
Vanessa, before we go, tell me something. Right now, it's not a secret what we are going through right now with the coronavirus. People are starting going back, maybe out of shape. Some people are maybe a little bit frustrated, whether they are professional, students. What is your advice, recommendation when they come back?
Yes, this is a big deal right now. So I've recently evaluated a few new dancers coming into Ballet Austin, and we had this same conversation. And I really tried to impress upon them and upon our whole company and everyone listening, it's really important to start to ramp up your cardiovascular training, because not only has it been off season, but people have been dancing at home. And not even, in a studio space, no guesting over the summer, very little chance for a huge amount of swimming or other forms of cross training. It really has been quite sedentary. And so now we're asking dancers to come back, and they're going to be in that large studio space again. They're going to be jumping. Most of our Zoom ballet classes did not really involve any jumps or center. It was bar on a daily basis. So dancers need to be upping their cardiovascular training every day right now in preparation for getting back into the studio. So this goes for academy dancers, this goes for studio, company dancers. So there are some excellent papers that have been put out by Dance USA. I'm part of the task force on dancer health. And so a group has put together these really wonderful guidelines on returning to dance. And what are the specifics for cardiovascular training as we return to the studio? Those can be really, really helpful. I think like what we have to look at right now is we're looking at Europe, right? So they're returning to the studio, and how are they doing with everything? And they're going to be a really good lesson for us to learn off of. But the biggest thing I want to impress is do your cardiovascular training before you get back into the studio. Because if you are fatigued with like the first petit allegro, it's a downward spiral, right? Fatigue is where injuries occur. So we want to ramp you up, get you strong so that you can keep dancing.
So thank you once again, Vanessa.
You're welcome. Take care of your throat. Take care of your throat.
Goodness.
Yeah.
Everyone who knows me knows my voice is kind of like that, but today I feel like this is going to explode.
Yeah.
You're such a nice person. Thank you so much for giving me this.
Thank you. Have a good rest of your Sunday.
Absolutely. You too. You too.
Bye.